this may be a hot take, but I feel like all of these changes are coming to Medicaid with long-term care facilities because people have been taking advantage of Medicaid. Let's be honest. Majority of people who have the means to afford long-term care are not paying for it out of pocket. They are paying for it via Medicaid. How? They are locking away all of their assets in a trust. The house, the car, the land, the bank accounts, everything, so that Mary Kate can have the house when grandma die. So that so-and-so can get money out of the bank account when so-and-so die. But in reality, if y'all sold the house, sold the car, sold the land, cleared the accounts, grandma will be able to live at some really nice facility for the rest of her days. But because y'all want her shit when she die, y'all lock it in a trust and y'all apply for Medicaid. Y'all scammers. And those are the same people who are saying poor people just want to live off government assistance. Medicaid is government assistance. So if you are locking all your loved ones' assets away in a trust and then applying for Medicaid, your loved one is living off government assistance when you have the means to take care of them. So probably that's why Medicaid is coming up. Like if y'all inheriting shit and y'all income level have changed, y'all no longer qualify for long-term Medicaid. And that checks out. Like, I don't see an issue with that. For me personally, I know families. I have worked with families who have said like, oh no, that's in a trust, so we can apply for Medicaid. Sell the fucking house. Sell the fucking house, Jennifer. Mom needs a place to lay her head at night and you don't want to take her home with you and your kids. Sell the fucking house. So I know that it's not just me who has experienced this with patients or families. So my last video was kind of long, so I'm pretty sure some people didn't watch it all the way through, but I received several comments stating this: paid into Medicaid. You don't pay into Medicaid, which is why we are here. This is why we are talking about Medicaid and the cuts and the funding and everything like that. You pay into Medicaid via taxes, maybe, sure, but nobody pays directly into Medicaid. You pay directly into Medicare. What you see here is my pay stub from today, as you see, AA. And below you will see my taxes, federal withholding, Social Security, EE, Medicare, EE, because we pay into Medicare, California withholding, California DTEE, that is our state disability insurance. Not all states have that, only 5 states have that. But yes, these are my taxes that I withheld from my pay stub. So which one of those is me paying into Medicaid? Because we don't pay into Medicaid. Now, if I'm wrong, correct me and send some receipts. But from my understanding, we do not pay into Medicaid. It is government funded, which is why we are here having this conversation about using the government funds when you have resources. Thank you.
Guess which race has the highest percentage of people on Section 8?
So the vast majority are definitely Caucasian. And I only know this because I've been a Section 8 investor the last 10 years. And I'm going to share the dirty secret about how some of these folks are still living 6-figure lifestyles while qualifying for government assistance. 7 years ago, I had an 8-figure mentor teach me all about leveraging OPM and trust structures. Now, his friends and associates have been gaming the system using these trust structures for decades. They're using other people's money and credit to buy these assets that the trust structures own. All the income that's coming from these assets are going directly to the trust. As a trustee, they can pay themselves a little bit of nothing every year, therefore qualifying for Section 8 or government assistance if they choose to. The income also allows these trustees to pay for trust expenses. Think about all the needs of a beneficiary: school, clothing, daycare, shelter, you name it. Now they also have the resource to set up something like a private family bank. So while you're getting judged on your W-2 income, they're able to pay themselves based on the acceptable poverty levels. Now,
Happy Friday. So I want to do a follow-up video to my video from yesterday because clearly the comments was coming in and I couldn't keep up with all those comments, and I'm probably not going to respond to any more comments on that video because it was just way too many. But first things first, I said what I said. I mean, you don't have to agree with what I said. That's perfectly fine. And sure, it could be a hot take as me, as a odd take as me being a social worker to say what I said, but I said what I said. So I just want to do a follow-up video to that video, and I have notes because it was just so many comments and I literally could not keep track of all the comments. So I want to start with, I am aware that putting your assets into a Medicaid trust is legal. It's literally called a Medicaid trust. I am aware that it is legal. But again, I said what I said. If we're being honest, the whole entire healthcare field is a scam. From the hospitals to the nursing facilities, the assisted livings, home health care, everybody. Scammers. I literally tried to put my patient in the emergency room in a SNF for a few days while her family made out a plan to take her to another state or get caregivers, and it was $900 a day. Who was paying $900 a day? A scam. Home health care agencies charge family $50 and up for caregivers at home, when in reality, I know for a fact their overhead costs is not that high to charge that much and only pay their caregivers half of that. I might be wrong, but I would love to see their budget breakdown and their whole play-by-play, because there's no way in hell that families should be charged $50 plus for an hour for caregivers at home, and the caregivers are only making about 18 of those dollars. So, scam. Everybody a scam, if we're being honest. And I saw several comments that said, why should grandma have to give up everything she worked hard for and she's paid into Medicaid? Nobody pays into Medicaid. Medicaid is a government-funded program, which is why we are here right now talking about Medicaid and cuts and things like that. It is a government-funded program. And we pay taxes that go toward it possibly, but nobody directly pays into Medicaid. What grandma and all of us directly pay into is Medicare, which you can see on your check stub, and Social Security, which you can also see on your check stub. And if we're talking about Medicare, which we all directly pay into, let's be honest, they don't do enough. Medicare requires you to have too many parts to get your needs met. You need to have A, B, C, D, and a supplemental. It's way too much. And when we think about Medicare, there are Medicare Advantage programs, and they can do more, like caregivers, maybe a SNF stay, or it's like a wraparound care type thing, like PACE. For y'all who are familiar with PACE, it's like all-inclusive care, like, sure, with Medicare. But Medicare really doesn't do enough to support patients, or it just doesn't do enough. And honestly, a lot of facilities do not like those Medicare Advantage plans. So if your loved one has straight Medicare right now, please encourage them not to sell their Medicare to a Medicare Advantage plan, because a lot of facilities don't take it. In my experience, I have had patients get declined for facilities because their Medicare Advantage plan wasn't paying the facility. So the facility was like, no, they can't come back here. They have a bill of $19,000 because their Medicare Advantage plan did not pay. So I don't know why facilities don't like the Medicare Advantage plan, but like everybody doesn't. Our facilities don't rock with the Medicare Advantage plan. All right, moving on. Okay, so I just mentioned that. Most, if not all, Medicaid facilities are not that great. They're not that great. So if grandma lived a very luxurious life and she was popping her shit and like her house is A1 and, she just lived a really good life, putting her into a Medicaid facility at end of life is cruel, because they're not that nice. At least the ones that I've seen that are Medicaid accepting long-term care patients, they're not that nice. I mean, they're not in there abusing. Well, some of them, I did work for APS, so I do know what they be doing in there. But they're not absolutely awful, but they're not that nice. So I just want to make that clear. Honestly, I think the bigger overarching issue outside of healthcare being a scam is that people don't really plan for end of life. People don't really plan for their end of life care, because if they have children, they expect their children to take care of them. But the reality of that is, if you have been a great parent or great parents, your children are full, functioning, thriving individuals in society. They have their own families. They're doing their own things. So realistically, they might not be able to support you at end of life. And again, it's important for everybody to start planning for end of life. Even us now as younger people, like, we aren't having kids, so we ain't planning on our kids to take care of us at end of life. We are taking the necessary steps to make those plans. So again, that is another issue. People aren't planning for their end of life care, and it might look like ending up in facilities because they have no one to take care of them at home. I know several people mentioned, why should grandma have to give up her house she works so hard for because she needs care at end of life? She don't. Why can't y'all just take care of grandma at home? Hire caregivers and let her die in this house she worked so hard for, versus putting her in a facility and letting her die with strangers. I mean, it's a possibility. Sure, like I just mentioned, the home health care can be a scam. But wouldn't you rather let grandma die in this house that she worked so hard for than putting her in a facility? That's just my personal question or opinion. Like, this is TikTok. Everything on TikTok is the creator's opinion. So if I say something and you're not fucking with it, or you don't like what I have to say, again, this is my TikTok, Sagacity, my TikTok, my opinion. So if you don't like it, keep scrolling. You can comment your little wild ass comments. I don't care. But everything that I say on this page here is my opinion. And I truly believe that people need to... America is an individualistic society, okay? It is an individualistic society, and it's dog eat dog, every man for themselves. So more families need to come together to support their loved ones at end of life, to keep that generational wealth, to keep those things in the family, just for a better quality of life. Majority of the people in facilities are not happy. They are not happy. They are not living happy lives. They're miserable in those facilities. If you have visited your grandma or your grandpa, uncle, auntie, whoever in these facilities, you know that they are miserable and they would rather be at home. So just take them home and get some caregivers. And again, I should state, I am not against these trusts in this situation. But what I said was, people who are utilizing trusts can actually afford care, and there are people out there who genuinely cannot afford care, and they need Medicaid to support them at end of life. I saw a comment saying that we're so brainwashed. Medicare, healthcare is free in other countries. Yes, healthcare is free in other countries. It is not free to live in a SNF in other countries. It is not free to live in facilities in other countries. It costs, just like it costs here, a whole lot of money. It's a business. Sniffs, scam. When it's my turn, the goal will be to keep my mom and my grandma at home. My mom and my grandma at home right now. Obviously, I don't live at home with my family, so I plan to support with paying for caregivers if I need to, or I will take time off from my travel job and go home and support my family. But like, in reality, more families just need to step up. And I wasn't trying to cause chaos and commotion here on this little TikTok. I was just making a general statement about my opinion. So again, if you don't like it, keep scrolling.
More than 70% of the nation's nursing homes are now owned by for-profit companies, often backed by private equity or real estate investors. New research is raising troubling questions about their quality of care. CBS News contributor Lisa Ling first encountered these questions through her own family's experience, but soon found out she's not alone. Here's tonight's Eye on America.
This is Berkeley East, a for-profit skilled nursing facility in Southern California, where my 92-year-old mother-in-law, Grace Song, spent a month after a hospitalization.
When you go through all this stress, I'm just so deadly tired.
I began recording her during my visits after she told me she struggled to get the attention of staff. And medication she says she was told to take promptly at 8 a.m. routinely came hours late.
So then you're starting to panic because so much time is
passing by. So I was pushing the bus to find out what's going on.
One night, my mother-in-law, who was a fall risk, was left alone in the bathroom and fell. She hit her head and was sent back to the ER.
This is where you feel, how did I get to be so helpless?
More than 70% of U.S. nursing homes are now run by for-profit companies, and there's growing evidence patients are paying the price. Harvard professor David Grabowski is an expert on nursing home policy.
The vast majority of quality problems in the U.S. are centered in for-profit nursing homes.
Most U.S. nursing homes rely on taxpayer money from Medicare and Medicaid. Grabowski told us as profit-seeking investors have poured in, it's become more difficult to track where the money goes.
We really don't know kind of how they're using public dollars and whether they're actually going into direct resident care.
What is clear from federal research, many of these facilities have been found to have lower staffing and worse quality of care. In 2019, Berkeley East was taken over by a for-profit company called Aspen Skilled Healthcare, a mid-sized chain of more than 24 nursing homes.
How often were you exposed to examples of gross negligence?
It felt like on a daily basis.
This nurse, who asked to appear in shadow, left Berkeley East after working there more than a decade. She was one of 5 current and recent former employees who told CBS News patient care had been compromised after Aspen took over.
What would you say the biggest changes were?
When we try to call upper management, they wouldn't even pick up the phone or call us back. They would just leave us short on the floor.
Berkeley East has racked up so many serious quality issues that regulators say it requires special oversight to protect residents' health and safety, and dropped it from an overall 4-star rating to 1.
Labs weren't being reported in a timely manner. Patients weren't given their medications on time.
She also alleges that during the pandemic, Aspen took steps to conceal staff shortages from the state health department by listing names of nurses who appeared not to be working there on internal staff reports.
These nurses were nowhere to be found in the system.
While Berkeley East operated at a loss, data from its most recent financial records show overall Aspen's facilities reported more than $27 million in annual profits.
Where do you believe that money was going?
It was going to corporate.
My mother-in-law wasn't the only one who felt ignored. On one visit, her roommate said she couldn't find staff to change her.
I have no idea when she's coming back.
Aspen Skilled Healthcare declined to comment for this report. It recently replaced managers at Berkeley East and has reported staff levels that exceed state and federal requirements. In a statement, an industry lobbying group said it supports financial transparency and accountability, but says these issues distract from others like chronic government underfunding and a growing worker shortage. Nora?
Lisa, thank you for your reporting.
What up, Nurse Gang? What up, TikTok? So, looks like United Health is back in the hot seat. Today on Healthcare in the News, headline reads, United Health secretly paid nursing homes to reduce hospital transfers. Let's take a deeper look into it. United Health Group, the nation's largest healthcare conglomerate, has secretly paid nursing homes thousands in bonuses to help slash hospital transfers for ailing residents, part of a series of cost-cutting tactics that has saved the company millions, but at times risked residents' health. Those secret bonuses have been paid out as part of United Healthcare program that stations the company's own medical teams in nursing homes and pushes them to cut care expenses for residents covered by the insurance giant. In several cases identified by The Guardian, nursing home residents who needed immediate hospital care under the program failed to receive it after interventions from United Health staffers. At least one lived with permanent brain damage following his delayed transfer, according to confidential nursing home incident log recordings and photo evidence. No one is truly investigating when a patient suffers harm. Absolutely no one, said one current United Health nurse practitioner who recently filed a congressional complaint about the nursing home program. These incidents are hidden, downplayed, and minimized. The sense is, well, they're medically frail and no one lives forever. Wow. The Guardian's investigation is based on thousands of confidential corporate and patient records obtained through sources, public records, requests and court files, interviews with more than 20 current and former United Health and nursing home employees, and 2 whistleblowers. The documents and sources provide a never-before-seen window into the company's successful effort to insert itself into day-to-day operations of nearly 2,000 nursing homes in small towns and urban commercial strips across the nation, an approach which has helped United Healthcare secure a vast stream of federal dollars from Medicare Advantage plans that cover more than 55,000 long-term nursing home residents. United Health said the suggestion that employees have prevented hospital transfers is false. It said its bonus payments to nursing homes help prevent unnecessary hospitalizations that are costly and dangerous to patients, and that its partnerships with nursing homes improves health outcomes. Under Medicare Advantage, insurers collect lump sums from the federal government to cover seniors' care, but the less insurers spend on care, the more they have for potential profit, an opportunity that United Health higher-ups have systematically sought to exploit when it comes to long-term nursing home residents. To reduce residents' hospital visits, United Health has offered nursing homes an array of financial sweeteners that sounded more like they came from stockbrokers than medical professionals. Over the past 7 years, the company has shelled out premium dividend and shared savings payments that boosted nursing homes' bottom lines. Through its quality and shared risk program, United Health offered an even bigger cut to nursing homes that drove down medical spending but threatened to claw back money from those who didn't. The secret bonuses were just one of many maneuvers United Health devised to track and cut expenses in its nursing home initiative. Internal emails show, for example, that United Health supervisors gave their teams budgets showing how many hospital admissions they had left to use up on nursing home patients. The company also monitored nursing homes that had smaller numbers of patients with do not resuscitate or DNR or do not intubate orders in their files. Without such orders, patients are in line for certain life-saving treatments that might lead to costly hospital stays. 2 current and 3 former United Health nurse practitioners told The Guardian that United Health managers pressed nurse practitioners to persuade Medicare Advantage members to change their code status to DNR, even when patients had clearly expressed a desire to use all available treatments to keep them alive. What are your thoughts? Let's talk about it.
I have a bone to pick with the federal government and healthcare. How is it that the manual for long-term care regulations is over 700 pages? Regulating absolutely everything I do from the time I clock in until the time I leave. Yet, we still have no federal guideline, no federal regulation that says, hey, this is how many residents suffering from dementia one nurse can safely take care of. We still have no federal regulation that says, hey, this is the maximum amount of incontinent people one CNA can manage. So I'm going to say this very clearly. Until you regulate safe staffing ratios based on acuity, meaning how much care that person needs from us, there will be no change in healthcare. I'm going to say that one more time. Until we get federal regulations on acuity versus staffing ratios, there will be no change in healthcare. There are those of us out here killing ourselves, not taking breaks, working off the clock, staying late, picking up extra shifts to be able to care for people because, shocker, the company will continue to do whatever makes the most money. So if I can cut a nurse or I can run with just one CNA legally and take the highest acuity possible, trachs, G-tubes, ventilators in some facilities, dementia care, then I can pocket more money. I'm saying that there has to be some kind of federal regulation based on how sick these people might be as to how many of them I can manage safely. Nowhere in the 800 pages of this garbage does it tell me how many people I can care for safely, though it does tell me exactly how many seconds to wash my hands. Until that changes, you all better take care of yourselves. You better hire a sitter for your loved one. You better come in and spot check the facility, and you better move them the first time you suspect that they are not being cared for.